Welcome to today's press briefing. We have with us on the stage 3 doctors: Dr. Edwin Choi, Controller, Center for Health Protection, Department of Health, and Dr. Zhang Shuquan, Head of Communicable Disease Branch, and Dr. Larry Lee, Chief Manager from the Hospital Authority. Dr. Zhang will first give you an update on the cases. Good afternoon. As of last night, we've confirmed 6 cases from 12605 to 12610. 5 cases have been confirmed to be patients carrying the N501Y and T428K variants, and the gene sequencing will be performed for confirmation. So far, 14 preliminary positive cases have been identified. Coming back to the 6 cases confirmed today, 12605 is a 39-year-old male arriving at Hong Kong from the United States on the 26th of December via flight 6881. The case has been identified at the airport. 12606, again another case from the US. He's a 16-year-old male, again identified at the airport coming via the same flight on the 26th of December 6881. 12607 is a 61-year-old male arriving at Hong Kong from the United Kingdom. His second specimen provided at the Penny's Bay Quarantine Center has been identified, and he arrived in Hong Kong on the 25th of December via CX216. 12608, a 51-year-old Pakistani male arriving at Hong Kong via flight EK384 on the 22nd of December. His other family member is also another confirmed case. So they've been transferred from the designated quarantine hotel to the Penny's Bay Quarantine Center. His 4th specimen tested positive. And there are also 2 other cases involving airline crew. 12609 is a 45-year-old male. It's a crew member. He arrived at Hong Kong from the US via flight CX841 on the 24th of December. At the airport, he tested negative, so he was allowed to go home. He lives in 1 South Lane, and after arriving home, his specimen collected on the 3rd day, on the 26th of December, at Chek Tong Choi tested positive. And he is a case involving N501Y plus T478K. On the 21st of December, via flight CX844, he went to New York along with the pilot and the crew, and he stayed in a quarantine hotel in New York. On the 24th, he arrived back in Hong Kong via another flight, and that is a cargo flight, CX841. After arriving in Hong Kong, on the 25th, he went to a shop called Miniso in Sheung at 10:30. Around 10:30 on the 25th of December for shopping. So he stayed there for a while, and then he took 962, the bus, to a friend's place for lunch, and then he took 961, another bus back home. On the 26th, he went to the community testing center at Chek Tong Choi around 7 p.m. for testing. On the 27th, in Malay cuisine restaurants in Western Districts, he bought a meal and brought it home, and we suspect that he might have been infected during his stay in New York. The other crew member is 12610. This case involves a 46-year-old male who arrived in Hong Kong via cargo flight CX843 on the 25th of December. He lives in Twilight Court in Discovery Bay with his family members. On the 23rd of December, he flew CX-840 to New York and then returned to Hong Kong via CX-843. After arriving home, he mostly stayed home. And on the 26th, he attended the testing center in Discovery Bay. He tested negative, and then he took a ferry from Discovery Bay to Shek Tong Tsui at about 7 in the morning. After another round of testing at about 11 a.m., he took another ferry home. So basically, these were his movements. For these 2 crew members, they are cases of suspected variant of concern Omicron involving T478K. There is also another preliminary positive case involving another crew member who is a 40-year-old male. On the 25th of December, via CX-2807, a cargo flight, he returned to Hong Kong. And he's a friend of the other case I mentioned, 12609. On the 25th of December, 12609 went to his home for a meal. Now, by the time we knew 12609 to be a preliminary positive case, we already sent this person to Penny's Bay Quarantine Center. He's also an aircrew member. He lives in Ga Yue Bun Dao, Tower 1 in Tuen Mun. On the 22nd of December, via CX-2806, he went to Chicago and he worked in the business class section. Between 22nd and 23rd, he stayed in a hotel in Chicago, and then on 25th, he returned to Hong Kong via CX-2807, another cargo flight together with the other crew members. For case 12609, the friend went to his home for a meal, and then on the 27th at about 11 in the morning, he took a bus 60X to Prince Edward Station, and then he took MTR to the Apple store in Kowloon Tong to fix his mobile phone. He also went to a restaurant called Moon Face and had a meal with his family members. Then he took MTR at about 4 in the afternoon for testing in Shek Tong Tsui Community Testing Center. And then he took the bus 961 back home and stayed home most of the time. He lives in the estate called the Seacrest. This is a preliminary positive case, and I suppose his case will be confirmed by tonight. That concludes my report.
Now, Dr. Lee will tell us about the hospital authorities situation. As at 9 a.m. this morning, in the past 24 hours, we have reported 10 cases. In the past 24 hours, we have no patients discharged from hospital. So far, 161 patients are being hospitalized in the North Lantau Hospital and the HA's Infection Center. One is in serious condition. The remaining 160 patients are in stable conditions. For negative pressure, bad, 1,120, occupancy rate 58%. For negative pressure purpose, the percentage is 26.8%. Negative pressure rooms, we have 67% of rooms used for negative pressure purpose. You may have noticed that the occurrence of Omicron is causing outbreaks at different places. The hospital authority is prepared for a 5th wave. We are quarantining patients in two facilities, including the North Lantau Hospital and the Princess Margaret Hospital for manpower purpose. We have 161 confirmed patients in these two facilities. We have a total of 1,200 negative pressure beds in our public hospitals. In the North Lantau Infection Control Center, we have another 800 beds, altogether 2,000. So far, the number can still cope with the need. However, in case of a fifth wave, there will be a huge influx of patients and will cause huge pressure for our facilities. So we are ready to reopen the AWE quarantine center at any time. We can reactivate 500 beds to receive patients. Our clusters are also ready to receive additional patients, and we are going to carry out drills to familiarize ourselves. And also we have 600 second-tier quarantine beds in our public hospitals, which can be used in short notice. Of course, that is the worst case scenario. However, we just want to be best prepared for it. And also, I would like to urge the public, vaccination is the most effective measures to prevent an outbreak. We hope that those who have received 2 jabs can arrange for a 3rd jab in due course. Mr. Lee, or Dr. Edward Choi. Since November, we have identified the Omicron viral strain. In 2 months' time, it has been spreading very quickly globally. This is a graph showing Hong Kong's situation. We have shown you this before. The red bars represents the suspected or confirmed Omicron patients. Green bars represents patients with the normal strain. 2 months ago, Omicron represents 30% of the confirmed cases. Just last week, the number has risen to 78%. In the past 2 days, the percentage has risen to 95%. So we expect that most of the cases imported in the future will be of the Omicron variant. The characteristic is that this is a very infectious virus strain. When there are more cases from overseas and more Hong Kong residents coming back to Hong Kong, as shown by Dr. Zhang's report, we have imported cases who are Hong Kong residents as well as aircrew members. We have a very, very high community outbreak risk, especially regarding the highly infectious Omicron strain. So allow me to put it this way: a single spark can start the 5th wave. So please pay close notice to our announcement of closure and a test order. And also, if you have to be in any places with confirmed cases, please go to get a test as soon as possible to protect yourself and your family members. That is, for places we have issued a compulsory testing notice. For those who are still hesitant to receive a vaccine, please get vaccinated before the 5th outbreak. Given the highly infectious virus strain, the 5th wave will be much more serious and come much more quickly than before, and more people will be affected. For those elderly people and those immunologically compromised people, there will be very serious side effects or even fatal cases. So please pay close attention to your personal hygiene, maintain social distancing, and maintain hand hygiene. And if you have any symptoms, visit a doctor as soon as possible. We have significantly increased Omicron risk from aircrew members and cargo flights. That's why the THB is going to strengthen quarantine measures for aircrew members returning to Hong Kong. For cargo flights, crew members, they were allowed to undergo home quarantine. The regime will be strengthened to 3 days compulsory quarantine in hotels. With the strengthened regime, we hope that for the first few days, cargo flights crew members return to Hong Kong. Confirmed cases can be caught to reduce a community outbreak. Thank you. Now we will open the floor to questions. Please raise your hands and use a mic to ask questions, and also identify your media organization before you speak. The lady in a white coat. Good afternoon, I'm from TVB. Several questions. You mentioned the CHP will step up quarantine measures for cargo flight member. Why 3 days in hotel? There is a chance that the person is still in the incubation period and then he is released and then he will bring the virus into the community. Is 3 days enough? And also, we have several cases roaming in Shek Tong Tsui and Discovery Bay. How do you assess the risk of community outbreak? Do you expect to see an outbreak in the coming few days? They have been taking public transport as well. Is it too late to tighten the regime for aircrew members? And also, Professor Yuen Kwok Yung published an article today urging for universal vaccination and also a vaccine passport. So how does the CHP, what is the CHP's take on it? So is it necessary to make vaccination compulsory? About crew members, 2 months ago, when we had cases from aircrew members, we were highly concerned. Theoretically, the most ideal arrangement would be a compulsory quarantine period for aircrew members before they are allowed to go into the community. However, we understand that cargo flight members are essential for goods delivery to Hong Kong. If we implement such a regime, it would affect cargo flight members. We have been discussing with the CHP and air companies to provide the best arrangements, balancing the need for delivery. Previously, aircrew members were required to undergo home quarantine. They had to stay at home for the first 3 days at home, except for getting a test or buying necessities. However, the Omicron is a very high-risk variant, and also we have had several confirmed cases returning from the US who were tested positive after the home quarantine period. So that's why we consider it necessary to tighten the quarantine arrangement. Well, whether 3 days is ideal, well, this is a balancing exercise. We hope we can catch the cases within that period. Of course, we cannot rule out the risk entirely after the 3-day quarantine period. There may be patients still in the incubation period after that. That's why we will remind the aircrew members to adhere to quarantine infection control measures after returning home, including avoiding crowded places and monitor their health. If they display any symptoms, they have to notify their companies and stop coming to work. We will keep monitoring the situation to see whether more stringent measures are required. Definitely, the risk of a community outbreak is very high. That's why we have to tighten the measures. Testing regime for aircrew members is once per 2 days. We hope that when we identify the case, they are still in the early period of infection and less infectious. Some cases have been visiting friends and taking public transport. These are also risks. So we are going to announce high-risk places to the public and urge those who have been to these places to get a test.
Addressing Professor Yuen Kwok-yong's comments on a vaccine passport, we subscribe to Professor Yong's view in the sense that we would like to see a higher vaccination rate. And that is why we have been sparing no effort in appealing to the public to get vaccinated. Any misunderstanding, any inquiries about vaccines should be made with your doctor. And for members of the public who are still considering to get the jab, please bear in mind that we are facing daunting risks and the next wave of the epidemic might arrive very soon. And if you are vulnerable in a individual, vulnerable to serious diseases, you should be even more vigilant. And even if you don't travel outbound, you might catch the disease if there is a community outbreak. As to whether there are other measures to further incentivize the public to receive the jab and boost the vaccination rate, we will discuss with the professor. Next question. This lady wearing a hat at the back.
MP. First of all, I'd like to clarify the aircrew patients, so case 12609 and 12610. Did they violate their isolation rules given that, one of them was out at the Apple shop and also eating lunch with family, I think on the second day after arrival? And is the preliminary positive case, who's also aircrew, considered local because case 12609 went to his home for lunch? And in terms of the 3 days of hotel quarantine for cargo aircrew, is that enough? Is that stringent enough given that most of the close calls we've had in Hong Kong are involving aircrew? And do you think a vaccination passport to enter an individual's workplace is necessary to return to normalcy? Thank you.
Okay. Next, we will let Dr. Zhang to respond to your question about the two cases involving the cargo crew.
12609 and 126, you mean the preliminary sorry. The preliminary positive case is a close contact of 12609, but he also had a travel history to Chicago before he came back on 25th. So we need the whole genome sequencing to differentiate whether it's an imported case or import-related case. We need to check with the airline on whether they violate the exemption condition. But according to our understanding, they can do some essential testing. Yeah.
So back to the question about whether the 3 days quarantine in a hotel for cargo crew is enough or not. So it depends how we take the risk, because we're balancing between the risk of the infectious disease outbreaks and also the operational needs of the cargo crew. So at present, for the Omicron strain, the reported incubation period is around 3 days to 5 days, normally in 3 days. So there should be some cases that beyond 3 days, of course. So we have to balance between the risk of the infectious disease outbreaks and also the cargo operation. So at present, we try our best to work with the airlines and also the transport and housing bureau, and we implement these measures of the 3-day quarantine in the hotel, trying to intercept the case once they arrive Hong Kong, so in the first 3 days. So of course we'll review the strategy, and we will change the strategy if there's any new information coming about. So regarding the vaccine passports that is promulgated by Professor Yuen's team, of course we are on the same page with Dr. Yuen's team, because we are also, as a government, now is encouraging all the citizens to get the vaccination as soon as possible, including the primary series and also include the booster dose, of course. So we have actually implemented quite a number of vaccine bubbles in Hong Kong, including the workplace requirements and also the entering the government premises requirements. So whether or not we should implement a more stringent requirement, we have to closely observe the present situations and also the response of the citizens and also the upticks in the futures.
Next. This lady wearing a red scarf in the front.
I'm wondering,
Would you please introduce your organization first?
Oh, hi. My name is Kari. I'm from Bloomberg News. I'm wondering, are all kids under the age of 12, will they be given Sinovac even though it's proven less effective? And is there any, given the new situation and what you've just mentioned with the cargo crew, is there any chance that the quarantine measures for incoming travelers will be either shortened or changed given the incubation period for the Omicron variant? And thirdly, is there any other news on the border reopening situation with mainland China? Thank you.
Okay, so regarding the question about the vaccinations of children for Sinovac, indeed we have a discussion in the Joint Scientific Committee last week about whether we should give the Sinovac to children less than 12 years old. At that time, experts in the committees are still trying to find out more scientific information to justify the use of Sinovac for children less than 12 years old. Of course, the Omicron situations and the risk of Omicron spread in Hong Kong is one of the considerations to be considered. So at present, the recommendation for Sinovac for children under 12 is yet to be arrived. But we will conduct another round of Joint Scientific Committee maybe next month with more data and also with more present situation of the Omicron situation in Hong Kong to decide whether there should be a new recommendation for the Sinovac for age less than 12. So the second question is about the
Quarantine period.
Oh, the quarantine period, yes. Yes, indeed. The epidemiology of the virus is changing quite rapidly. So at the beginning, the incubation period for a COVID virus is about 7 days to 14 days. And for the Delta, we suspect the Delta is longer, so we extend the quarantine period from 14 days to 21 days at that time. So now we are facing another new strain, which is Omicron, which has a shorter incubation period. Yes, indeed, we are currently reviewing all the information, and certainly we will change our strategies in the future when there's more information to justify. A shorter quarantine period is also effective in preventing the spread of the COVID in Hong Kong. For the consideration of the opening borders with the mainland China, I think this is one of the major tasks our government is working towards the directions. Okay, Nick.
Next question. This reporter in a brown jacket. I'm from Now TV. Good afternoon. My first question is this. About the 2 aircrew members, they basically had some activities on the 25th and the 26th. That's during the Christmas holidays where streets were crowded. And I'd like to know your assessments in relation to their visits to major shopping malls such as the Festival Walk. Would that cause a greater risk? And would that cause a higher and imminent risk of an outbreak, like you said? And would you consider that the 5th wave of the epidemic has begun? And the next question is this. That's all.
Thank you. All along, to prevent importation of cases, our strategy is to mandate a longer quarantine period. So if the patient displayed symptoms during the period, he would be still within the quarantine period, and that would minimize the risk to the community. For certain groups, for example, aircrew members, we have to balance the quarantine measures against the operational needs. The 3 cases mentioned by Dr. Zhuang, when they entered the community, they were not identified to be patients, so there is definitely a risk. During the incubation period, they have been to different places as well, malls and public transport. That is, of course, not ideal, because there would be a risk to spread the virus. That's why we are going to publish a detailed list of places which will be put on compulsory testing. Those who have been to these places should get a test as soon as possible. The Omicron variant is very infectious, especially for crowded places. So we have to monitor the situation closely. Whether we are seeing the 5th wave already, well, we define that by second generation infection. So far, all cases were caught when they arrived at Hong Kong. They have been caught in quarantine centers. In the cases of crew members, they were identified by testing when they returned to Hong Kong. We do not see any second generation infection yet, but once it starts, the spread of Omicron will be very quick. The lady in a yellow jacket. Good afternoon. I'm from an online news agency. The government is implementing the 3rd jab soon. So do we have enough doses of Comirnaty or BioNTech? Is it enough for everyone to get a 3rd jab? I don't have the exact figure. In a press conference earlier on, it was announced that we still have some 2 million doses of Comirnaty or BioNTech. I don't have the figure for Sinovac or CoronaVac. Before we roll out any vaccination plan, we would look at the stock of vaccines we have, and we would look at the number of vaccination in the coming months. We are already giving the 3rd jab for high-risk groups. We have begun the 3rd jab for Sinovac. For BioNTech, last week we announced the 3rd dose for BioNTech receiver. The public can start registering for a 3rd jab on starting the 15th of January or the 1st of January. We have enough doses for everyone to get the 3rd jab, and we will make arrangements to procure more if necessary. Hi, I'm from Hong Kong Economic Times. For cases today, what are their symptoms? And also, how many close contacts are we talking about for those 2 pilots? Previously, Cathay issued an internal guidelines that aircrew members can only go out for 2 hours per day in the first 3 days. So have they violated the guideline? And also about the crew member case 12609, is the government going to take any action? Experts had said that we need a closed-loop management for hotel quarantine. So does it mean that we have a loophole because we are allowing aircrew members to undergo home quarantine? Concerning the upcoming three-day compulsory hotel quarantine, do you have a timetable? And what about the follow-up measures? Will aircrew members be allowed to roam free after completing the quarantine, and will this affect the resumption of cross-border travel? Dr. Zhuang will tell you the symptoms of the patients. For today's cases, for 12606, he has a sore throat. 12608, a fever. 12609, some coughs. About aircrew members, like I said, the current arrangements for certain aircrew members returning from the US, the requirement is staying at home for 3 days, except for getting a test or necessary grocery shopping. Like Dr. Zhuang said, from the look of it, it seems that some cases went out for unnecessary purpose. So the CHP would investigate the cases. I mean, they went out for non-essential purposes. So we should prevent aircrew members from going out for non-essential purposes, because that would bring unnecessary risk to the community. The 3-day quarantine period is a balance. Of course, the most ideal practice would be to quarantine the aircrew members for a prolonged period. That would be the least risky. However, we have to balance the risk against the operational needs. Without cargo flights, the delivery to Hong Kong would be cut off. So the THP has concluded that given the 3 cases, we have to tighten the quarantine measures for aircrew members. It may cause inconvenience to aircrew members, but that is necessary. About the follow-up measures after the 3-day quarantine, given the long incubation period, the 3-day quarantine period would not rule out the risk entirely, because patients may still be identified as positive on the 4th or 5th day. However, the aircrew members will be required to get regular tests and avoid non-essential gatherings and avoid crowded places, and they would have to see a doctor if they displayed any symptoms. The surveillance period would be between 7 to 14 days, depending on individuals. About resumption of cross-border travel, we are working on that together with bureaus and departments. The fact is, if we have any local infection, it would definitely affect the arrangement, because we would be very busy dealing with local outbreaks, and it would affect the timetable of resumption of cross-border travel. We are at a point when we are very worried about the outbreak of a 5th wave, so we are asking for the public's cooperation. Please get tested if necessary, and get vaccinated if you haven't yet. We have to take a tally. They don't have a lot of close contacts in the community, just a few, mostly aircrew members who flew with them. We are currently taking a tally. Next question. The gentleman in black. Good afternoon, RTHK. You mentioned that local cases would affect resumption of cross-border travel. Currently, given the outbreak of the Omicron variant, should we put on hold any plan to resume cross-border travel and with the mainland and the world to avoid a 5th outbreak? And also, you mentioned that a spark would ignite a 5th wave. So, which segments do you think is the most risky?
Well, as I said, our analysis is that we are now facing heightened risks because if we take a look at the data, the majority of cases have been identified either at the airport or in the quarantine center. But for the 3 cases reported by Dr. Zhang today, they were only identified after the cases have returned to the community, which means heightened risk for the community. Aircrew members are subject to frequent testing requirements, so the advantage is that these cases could be identified at an early stage of onset, which means a lower transmissibility of the disease. And that is why our approach is to issue compulsory testing notices and to conduct contact tracing. It is very important for the public to get tested if there is any contact. About reopening the border, and I think over the past 2 years it has been an issue close to the hearts of the government as well as the public. Whilst we are making an all-out effort to fight the epidemic and ensure that there is no local outbreak, we can still continue to consider borders reopening. At the moment, we do not have a second generation of transmission. If we're able to do the gatekeeping job properly, these cases could still be regarded as imported cases if there is no second generation infection, and that we can adjust the strategy to further reduce the risk of further cases. Next, I'm from Hong Kong 01. Good afternoon. I'd like to clarify a few matters. Yesterday, CHP mentioned 12609 and said that on the 23rd of December, he arrived at Hong Kong from the United States. Today, you corrected the date as the 24th. Also, you said apart from shopping for necessities, he had stayed home most of the time, and you also just told us that he went to his friend's home in Tuen Mun for a meal. Can we say that he has concealed his movement records? For these exempted aircrew members, they are required to be tested at community testing centers, which means a risk of spreading the disease. Would you consider collecting specimens at their places of residence instead? And about vaccine passport, according to Professor Yun, this should be done next year. Do you have a timetable for that? Let me first respond to your question on vaccine passport, and then Dr. Zhang would tell you more about the movements of the cases. Now, the professor's recommendation is something that we pay close attention to because this is one way to boosting the vaccination rate. So, of course, we'll closely monitor and consider the information provided by the professor and his team. And about our work, as reported just now, we have incessantly reminded the public to get vaccinated. And we also work with our healthcare professionals in appealing to the public the same. About restaurants, at the moment we have another vaccine bubble arrangement, and that the patients are required to follow certain requirements. And there may be other ways to further boost the vaccination rate in the future. Now I'll give the floor to Dr. Zhang to report the movements of the cases. I'm sorry, last night when the cases were first identified and confirmed, we made a mistake in the haste of time. In fact, on the 23rd, he flew outbound, and then he arrived in Hong Kong on the 24th. And that's why we made a correction today. As for the details, we just put questions to him again and clarified with him his whereabouts and his movements and when he visited his friends and went for shopping. Next question. I'm from Ming Pao. Good afternoon. 12609 and 12610, as well as the aircrew member living in Tuen Mun as a preliminary positive case. I'd like to know how many family members they have. And about the aircrew member living in Tuen Mun, he had a meal with his family. May I know how many family members attended the meal? And they also visited a number of places. 12610 went to Shek Tong Choi for testing. May I know why he went to Shek Tong Choi for testing? Is there any requirement for aircrew member to be tested at certain designated centers? As for 12609 and the aircrew member who is a preliminary positive living in Tuen Mun, according to the center's assessment, who is the source of transmission, or what is the source of transmission? And for the preliminary positive case living in Tuen Mun, does his case involve Omicron variant? As for the quarantine arrangement for aircrew members, may I know the ratio of confirmed cases between non-local and local aircrew members? And can you identify any trend about the new 3-day hotel quarantine arrangement? Do you have a timetable when this will be introduced? And also, after staying in a hotel for quarantine for 3 days, are there other measures once they return to the community? Because you already have medical surveillance at home as part of your existing strategy. But as we have observed, these cases indeed went to the community for meals or for shopping. Are there ways to further curb the risk? Let me respond to the second part of your question, and then I'll give the floor to Dr. Zhang for the first part of your question. We're considering the introduction of a 3-day compulsory hotel quarantine arrangement so that the possible onset of the disease upon their arrival will be able to identify these cases. In other words, they'll be exempted from staying home and then going out to the community for testing in the first 3 days. Like the other reporter asked, perhaps a specimen should be collected at his place of residence to reduce risk. Now, about the arrangement that ensued, the same surveillance arrangement applies. That means the case would have to stay home, not to go out for non-essential activities, and they'll be subject to numerous tests. The Transport and Housing Bureau, I suppose, is discussing with the airline companies, and I think later tonight a press release will be issued to set out the details. About the cases, Dr. Zhang, 12609 lives by himself, 12610 lives with 2 family members. As for the preliminary positive case, he lives with another family member. For the preliminary positive case, he had a meal with 2 other family members at the restaurant called Moon Palace. The preliminary positive case went for testing in Shek Tong Choi. I think we need to ask him why again, but there is no requirement as to which community testing center one should attend. The speaker is not coming through. I understand this case is also N501Y plus T478K, in other words, Omicron. As for these 3 cases, these are recent returnees from the United States. We understand there is a major outbreak in the United States, so we regard these 3 cases as imported cases. As for 12609 and the preliminary positive case, since they met and had a meal together, we need gene sequencing results to see if this is a transmission of disease from one to another or whether they got infected elsewhere.
Next question.
You said just now that you are on the same page with Dr. Yuen Kwok Yung in terms of driving up the vaccination rate. But in today's article, he specifically said that first, zero COVID strategy is not sustainable in the long term, and it's only a means to an end. So what is CHP's position on that statement? And secondly, Dr. Yun also had a specific vaccination target. He said 99% immunization by next July. Does the CHP think that is realistic? And is that also the CHP's position?
Thanks for the questions. So what I mean, we have the same page with Professor Yun's team is the boost for the uptake of the vaccination of Omicron, of the COVID vaccinations. So all along, we have tried whatever means to try to boost up the vaccination, including the advice to the public, and also to have some incentive to the public, like a lucky draw, which we have some of our commercial sectors has implemented to boost up the vaccinations of the citizens. So far, the uptake is about 70%, which is not very satisfactory. For some age group which cover the elder age group, the coverage is still at the low side. So what I meant for the same page is that we are trying our best to use whatever means to boost up the vaccinations of the people of Hong Kong. So whether or not we are following the serial strategies or the living with COVID strategies, I think Professor Yun's team is trying to describe this is not a long-term goal, but at present, as we are still facing the Omicron potential spread in Hong Kong, so as overall our government is still pursuing the zero COVID strategy at present. So we are doing all our best, like the colleagues have asked in the press conference today, whether or not we have to extend the quarantine period of any incoming crew members. All of these are the containment strategies, as I said. So at present, we are still adopting the zero COVID strategy, trying to contain the virus. Okay? So.
下一位嗰邊個第三行第二位女士。
Next question, the lady at the back. Good afternoon. I'm from Cable News. You said the aircrew members should try the best to avoid going out after returning home. Now they are roaming around. So have they violated the government's requirements? So should we make it mandatory to make them stay at home? And there are rumors that the government is looking at vaccination requirements for those who go to school and go to work. So should we really make it mandatory? Now, aircrew members are going to stay in hotels for 3 days after returning to Hong Kong. So how are you going to make sure that there are enough rooms for that? And how are you going to implement the requirements? Concerning the 3-day hotel quarantine requirements for aircrew members, so this is the direction only. For the specifics, I think the THB and the airlines will tell you the details in due course. Because we have the airlines have to book hotel rooms for the aircrew members. So very shortly, you will hear from them. For cases you mentioned roamed about, whether we should investigate the cases, well, it seems that it is really doubtful whether the patients went out for essential purposes. So the airlines are going to investigate these cases. Well, the aircrew members may have undergone closed-loop management from the origin country. However, the spread of the virus is really rampant in those places, so the risk is still very high. So we are seeing high ratio of infection from certain countries. If we lengthen the quarantine period to 3 days in hotel, then we will be much more likely to catch the cases. Whether we can prevent an outbreak, well, it really depends on the situation, and we have to balance it against the operational needs as well. Concerning vaccination, whether mandatory measures will be implemented, we don't have any information at this point. We are trying to encourage members of the public to get vaccinated on their own through different ways. But one day, we may have to tell people that if you don't get vaccinated, you are going to lose out on something. That's advocated by some academics as well. It is the same in some countries. If people are not vaccinated, they will not be allowed to go to some places, and they will have to pay on their own if they get infected. Let's take the last question. The lady over there, or the gentleman over there. I'm from AM 730. Some clarification about the 3 cases. Were the 3 crew members on duty on the flight back to Hong Kong? And do they have other family members in Hong Kong? And what are the restrictions in place for the 3 aircrew members? If we have the 3-day mandatory quarantine for aircrew members, what is the percentage that we still have a loophole? About the part when you said you agree with Professor Yuen, does it mean that you agree with the part about vaccination passport or about the resumption of cross-border travel? What I said about agreeing with the professor, I meant that we share the same opinion that we need to boost the vaccination rate. Professor Yuen is a team member of the expert advisory panel. Vaccination is of utmost importance. So we have to exhaust every means to boost the vaccination rate. Professor Yuen has been very clear. We have to use every means to boost the vaccination rate in Hong Kong. The 3 aircrew members who returned to Hong Kong, they were on duty on the flight back to Hong Kong. They must have a duty. That's why they were assigned to the flight back to Hong Kong. About the gathering of 2, there were only those 2 people and also another family member. I have to check whether the family member of the patient who has been to Tuen Mun was also there. Sorry, the speaker is not coming through the mic. We have to check with the THB about that. On a side note, I think we are all very concerned whether the 3 aircrew members have violated relevant requirements. We will pass on the epidemiological information we have gathered to the THB and the airlines to see whether the activities they have had in the 3 days were indeed essential. We have to find out whether they were out for essential shopping. So for Omicron, for confirmed and suspected cases, we have 74 Omicron cases, including patients with N501Y and T478K strains. Some 50 cases were caught before the 4th day upon returning to Hong Kong. A large number of cases were identified during the test and hold procedure. And we had sporadic cases identified on the 5th or 6th case, but 6 days, but most were caught before the 4th day.
Please repeat your question. Speaker's not coming through. The speaker's not using a microphone. The speaker's not coming through. Like we said before, based on the experience in the 3rd and the 4th wave of the epidemic, we have prepared ourselves for the worst. Like I reported just now, we have 1,200 beds, and we also have 800 beds in the North Lantau Hospital, Hong Kong Infection Center. And there are also 600 second-tier isolation beds and 500 beds available in the Asia World Expo. Altogether, we hope to make available 3,000 beds as a shield. And we also would like to implement that as quickly as possible because of the high transmissibility of Omicron. And if there are other issues emerging, we will consider other options to create an isolation density. That's the end of today's press briefing. Thank you.